of second doses to deliver. During April, Madam Deputy Speaker, around 12 million people, including many colleagues in this House, will receive their second dose. These second doses cannot be delayed, as they have to be delivered within 12 weeks of the first dose. In the last week, we've had a batch of 1.7 million doses delayed because of the need to retest its stability. Events like this are to be expected in a manufacturing endeavour of this complexity, and this shows the rigour of our safety checks. And we have a delay in a scheduled arrival from the Serum Institute of India. Now, I want to put on the record my gratitude to the Serum Institute of India for the incredible work that they're doing producing vaccine, not just for us in the UK, but for the whole world. Their technology and their capability, which has been approved by the MHRA, is remarkable. The Serum Institute of India are producing 1 billion doses of the Oxford AstraZeneca vaccine this year. It truly is a partnership that we can be proud of. I also want to put on the record my thanks to both AstraZeneca and Pfizer, who've been remarkable partners in this historic endeavour. We have committed to targets on which it is vital to say that these targets to offer the vaccine to everyone aged 50 and over by the 15th of April and to all adults by the end of July. I can confirm that we are on track to meet both of these targets. I also want to clear up some rumours that have been circulating and give people reassurance. There will be no weeks in April with no first doses. There will be no cancelled appointments as a result of supply issues. Second doses will go ahead as planned. Most importantly, the vaccine data published yesterday show the life-saving impact of this vaccine. It's not just that the vaccines are safe, it's that they make you safe. You are much safer having had one. And shortly, the MHRA will be saying more on this matter, which they, of course, keep under constant review. Madam Deputy Speaker, I know the House will also want to hear some good news from Gibraltar. Throughout the crisis, we've provided Gibraltar with PPE, testing, and a sovereign guarantee for their COVID spending. We have also provided Gibraltar vaccines, as we have with all other British overseas territories. And I'm delighted to be able to tell the House that yesterday, Gibraltar became the first nation in the world to complete its entire adult vaccination programme. I want to pay tribute to all Gibraltarians for their fortitude during this crisis and the kind words of First Minister Fabian Picardo, who said yesterday, "The United Kingdom has played a blinder on vaccinations and we are among the beneficiaries in the British family of nations." I agree. The vaccination programme has been a success thanks to a team spirit across the British family of nations. It hasn't always been easy. Of course, there are challenges thrown at us in what is the biggest civilian undertaking in history and that affects every single one of us. The whole House pays tribute to those who've helped to make it happen, including Emily Lawson and Kate Bingham, Maddie McTiernan, Ruth Todd, Nikki Kanani, Professor Jonathan Van Tam, Sir Chris Whitty, Sir Patrick Vallance, Wei Shen Lim, Sarah Gilbert, Andy Pollard, Pascal Sorio, my officials in the department, colleagues across this House, and so many others who've made this a success. With 25 million people vaccinated and a clear roadmap out of lockdown, we are taking careful steps out of this pandemic. Now, Madam Deputy Speaker, there are 7,218 people in hospital with COVID across the UK, down from a peak of almost 40,000 just 7 weeks ago. The rate of hospitalisations has halved in just the past 16 days. And thankfully, the rate at which people are dying has fallen by a third in the last week. As a result, I can tell the House that we are, from today, writing to all those clinically extremely vulnerable people to let them know that shielding will come to an end on the 31st of March. I want to thank all those who've shown such fortitude and all those who've done so much to look after the most vulnerable. The shielding programme truly has been Britain at its best, pulling together to help those most in need. And Madam Deputy Speaker, I know that colleagues in the NHS and social care are beginning cautiously to look to the recovery ahead. I know everyone in this House is proud of the life-saving work we've seen in hospitals across the country. Yet we also know that our battles against COVID-19 have meant that there are things that we've not been able to do, like routine treatments and operations. And the challenges of COVID are still with us. We must continue to treat patients with the disease, bolster our vital mission of infection control, while also laying the groundwork for a recovery that gets us back to where we need to be. We've backed the NHS at every point in this pandemic so that they can treat patients, stay safe and save lives. And I'm delighted to inform the House that we're backing them again today with a further £6.6 billion of funding for the first half of this coming financial year. This money is in addition to the £3 billion committed at the spending review last November to help the NHS meet the additional costs of COVID, while critically starting the work on the elective recovery ahead. Due to the pandemic, the waiting list for elective treatment in January was almost 4.6 million, and 304,000 people are waiting more than a year for an operation or diagnostic. Before the pandemic, we reduced the number of 52-week waits, so people waiting more than a year, from 20,000 in 2010 to 1,600. And we were in fact on track to get that number to zero, Madam Deputy Speaker, before the pandemic hit. This backlog of elective work is an inevitable consequence of the pandemic, and I know how NHS colleagues are as determined as I am to put it right. We're also putting £594 million towards safe hospital discharge. Over the last year, the NHS's existing discharge programme freed up over 6,000 beds, and with it, the valuable time of 11,000 NHS staff. We can be grateful that we're seeing so many people leave hospital and that our discharge programme has shown the way forward, ensuring people can get the very best of care outside of our hospitals, helping them off the wards and into the right settings with the right support at the right time. Our £500 million mental health recovery package will help tackle the challenges that the pandemic has wrought in access to mental health services. And I can also confirm that we'll be extending enhanced discharge arrangements for mental health patients, getting patients safely from hospital into healthy community settings, providing better care and freeing up thousands of beds. And this challenge of mental ill health is so important. We all need to keep looking out for each other and doing all we can to strengthen our mental health. Tackling mental ill health is a core objective of our NHS long-term plan, and this government is committed to seeing mental health treated on a par with physical health and deliver on the long-needed reforms that we've set out. Madam Deputy Speaker, I am equally committed to supporting the vital work of our colleagues in adult social care. Last Monday, we reopened care homes to visitors with a careful policy of a single regular visitor who will be tested and wear PPE. I know how important this is, and I know colleagues will be cheered by the stories we hear each day of more and more residents safely reunited with people that they love. It means everything to them. I can today announce a further £341 million to support adult social care with the costs of infection prevention control and testing that will make sure visits are safe for everyone. This takes the total infection control fund and testing support to more than £1.6 billion, alongside the free PPE that care homes receive. Madam Deputy Speaker, the pandemic has tested our NHS and our social care system like never before. That they have risen to meet the challenges of the past year is down to the incredible dedication and hard work of colleagues. They have our thanks. We will deliver on our commitments. We will build 40 new hospitals. We will hire 50,000 more nurses. We will vaccinate this country ahead of almost all others. We will back our NHS and social care as we build back better for everyone. And I commend this statement to the House.
I call the Shadow Secretary of State, Jonathan Ashworth.
Thank you, Madam Deputy Speaker, and as always, I thank the Secretary of State for advance sight of his statement. Now, our constituents will be worried and anxious and disappointed at the news on vaccination last night. It has been an unspeakably horrific year. We've got one of the worst death rates in the world. Our economy has taken a massive hit. Many key workers under the age of 50, like teachers and police officers who, through the nature of their work, are not at home, they are going out, they are more exposed to risk, had been hoping that vaccination for them was not far away. So we understand why there will be delays in supply. Of course we understand that, but this is not fantastic news, and nor, frankly, is it expected news. On Saturday, the government sources at least, were briefing the Daily Telegraph of a bumper boost that everyone over 40 would be offered their first vaccine by the Easter. Last week, the business secretary was hinting that all adults could be vaccinated by June, saying there's no reason why we can't be optimistic. On Monday, Nottingham and Nottinghamshire CCG began inviting those in their 40s for vaccination. There was a similar invitation went out from Bury CCG as well. So we are grateful for his update today, but it will be a surprise to many. He didn't mention Moderna supplies today. I understand that supplies from Moderna will start in April. Is there any prospect that if Moderna supplies come on stream, that new appointments can be offered in light of this? Now, about 11 million people received their first dose between January and February, and I listened carefully to what he said. Can he just clarify for the House and for our constituents, is he offering them an absolute guarantee that all of those will get their second dose within the 12 weeks throughout April? Our constituents will be keen to just get that absolutely clarified. Now, the vaccination programme will need to ramp up to about 3.5 million doses a week from May to ensure that everyone under 50 is vaccinated by mid-July. Is he confident that these supply issues will be fixed by May? And is there any prospect of doing more than 3.5 million jabs a week from May? So, because, for example, we heard today from Adam Finn of the JCVI that infection rates may rise as a result of the delays. Does he anticipate that any of the stages in the roadmap easing out of lockdown, when any of those dates will be pushed back, given that we are quite rightly judging that roadmap by data, not dates? Can I also, on behalf of the official opposition, Madam Deputy Speaker, take this opportunity to support the AstraZeneca vaccine? Now, of course, where people are worried and have concerns, those worries and concerns must be addressed and not dismissed. But this is a concern at the moment. I mean, yesterday, for example, I was told that hundreds of people failed to show for appointments at the Excel Centre, and we think that is because of concerns and misinformation circulating online. And there are parts of the country where infection rates remain relatively high and vaccination rates relatively low. I see this in my own Leicester South constituency. So will he pull together a cross-party task force of community and local leaders to look at tackling these vaccine hesitancy issues? I offer again to work with him on that on a cross-party basis. Madam Deputy Speaker, children make up around 21% of the population. So that is a large segment of the population who will be lacking immunity. Obviously, research and trials are ongoing, but does he have a timeline for when he hopes to vaccinate children? Does he anticipate, for example, being able to vaccinate children this autumn, as Anthony Fauci in the US has suggested could well happen over there? Because even as vaccination rolls out, the virus continues to circulate, and new vaccine-evading variants could emerge. And we may need booster jabs in the autumn, and winter will be challenging. So driving up vaccinations across the whole of the population is so important. Now, on these budget allocations that is announced for the next 6 months, finally, I welcome extra funding, of course. Can he guarantee that the NHS will continue to get additional funding after the 6 months, if needed for COVID care? But as he references, people are waiting longer for treatment, over 300,000 people waiting over a year, risking a permanent disability or loss of livelihood, thousands waiting too long for cancer treatment, risking loss of life. But we shouldn't have to choose between cancer care and COVID care. We're also facing a mental health epidemic as a consequence of this crisis. But crucially, Madam Deputy Speaker, when we entered this pandemic, because of years of underfunding, bed cuts and understaffing, we had growing waiting lists. Our INEs were in crisis. We were missing cancer targets. So can he tell us when he expects to bring down these waiting lists and meet the various cancer targets again, Madam Deputy Speaker? And finally, he didn't mention NHS pay today. He claps NHS workers, he claps nurses, but he is introducing a real terms pay cut for our NHS staff. Can he tell us whether he will implement any recommendations of the independent pay review body, and if they recommend an increase above 1%, can he assure us that the funding will be additional to what he has announced today? But in truth, Madam Deputy Speaker, if he really wants to value NHS staff, he should withdraw this pay cut now.
Secretary of State.
Thank you very much, Madam Deputy Speaker. Well, I welcome the right honourable gentleman's support for the vaccine rollout and the clinically led approach that we've taken in this country. And I mean that as more than simply a polite gesture. I think it is vital and important in this country that we have such a strong cross-party consensus, which includes all parties represented in this House, behind the vaccine programme and behind the science. And the science means, of course, that we should, and we do, publish any side effects, and we are open and transparent about that. But we also make an assessment as to the benefits and how those benefits weigh against side effects. And it is absolutely clear from the data that we've seen so far that the vaccines are both safe and they make you safer than not getting vaccinated. And that is an absolutely critical fact. And the MHRA will very shortly be setting out more details, and it is properly for the independent regulator to set out those details. He asked about supplies from Moderna. We do expect supplies from Moderna in the coming weeks, and I'm very grateful to Moderna for the work that they have done. Of course, we've always been cautious about setting out future supply details, and the experience of the last 24 hours makes me even clearer that it is far better for us to set out clear commitments to the public in terms of when people can be vaccinated, which means all over 50s now can come forward, and we are committed to and on target to offer to all over 50s and groups 1 to 9 by the 15th of April. But we know that supply figures move up and down, and we've seen that throughout the rollout, and that is part of the normal management of this rollout. The commitment I can give him is that those who are coming forward for second doses, those appointments will not be delayed because of these supply issues, and also appointments that are already made will not be cancelled because of supply issues. So therefore, to any member of the public who's watching, what I'd say very clearly is that the vaccination programme is on track to meet the targets we've set out. If you get the call from the NHS, whether you get it through a letter, text or telephone call, Madam Deputy Speaker, or even these days an email, take up the offer and get the jab. He asked rightly about the roadmap. We are on track for the dates in the roadmap, and there is no impact on the roadmap from the changes to vaccine supply that we've been detailing in the last 24 hours. He asks about the vaccination of children and the autumn vaccination programme. Neither of these are certain. The vaccination of children is currently being assessed in a number of different clinical trials, and it's very important that we consider the results of those before making any decision. And it is likely that we will need a vaccination booster programme in the autumn, not least to deal with new variants, but that is, again, not yet certain. Finally, I'm very glad that he welcomed the extra funding that we're putting into the NHS. He asked whether after 6 months there will be more funding if needed for COVID purposes. The Chancellor has been absolutely clear from the start of this crisis that the NHS will get what it needs to deal with COVID, and that is very important, as is the work to restart the NHS in areas where it's had to be paused, and critically, the work that colleagues across the NHS will be doing to recover the backlog of elective work and make sure that everybody can get their appointments and their operations in a timely way on the NHS once more. That is the work of the months ahead, and I look forward to supporting NHS colleagues in delivering on it.
We now go to the Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. Was the Health Secretary as concerned as I was by comments by former Finnish Prime Minister Alexander Stubb on the Today programme this morning about the threat by the Commission President to block exports to countries that were ahead in their vaccination programme? He said that was a political reality, irrespective of any breach of legal contracts that it might involve. Does he not agree it's incredibly dangerous to make threats to the supplies of vaccines and components, alongside casting aspersions over their safety, at the very moment when vaccines are the only way the world is going to get out of our COVID straitjacket?
I agree with every word that my right honourable friend has said. I think that it is vital that we all work together. These supply chains for the manufacture of these vaccines cross borders. They are often global supply chains, and it is vital that we work together to deliver them. And there is a need for that cooperation, and there is, of course, a need for all countries to respect contract law. That is the basis of international trade, and I'm sure that the European Union will live up to the commitments and statements that it has made, including President van der Leyen herself, who has said that there should not be restrictions on companies when they are fulfilling contractual responsibilities. Of course there should not, and we fully expect those contracts to be delivered on, because there are very significant consequences to breaking contract law. There's one further point, Madam Deputy Speaker, which is that the Oxford AstraZeneca vaccine was developed because of UK taxpayers putting the funding in to the science, to the development, to the clinical trials, and because of AstraZeneca, with an incredibly bold and generous decision, which we fully support, but was their decision, to offer this vaccine around the world at cost. Working with institutes like the Serum Institute of India, Oxford and AstraZeneca are providing a vaccine for the whole world. They are not taking a profit from it. We are very proud of that fact. And that makes this materially different to other vaccines which have been developed for commercial advantage. I'm not against that at all. But let's celebrate what AstraZeneca have done, and it only underlines how important it is for everybody to work together in order to keep their populations safe.
We now go to the SNP spokesperson, Martin Day, who has 2 minutes.
Thank you, Madam Deputy Speaker. I'm grateful to the Secretary of State for advance sight of his statement. And of course, any additional funding for health is always welcome, especially during this pandemic. However, we must ensure that it delivers results. A Public Accounts Committee report has found that 22 billion UK government's test and trace system has had no clear impact on coronavirus infection rates in England. Will the Minister accept that the NHS-led track and trace was the correct option, not privatising public health? And can the Minister tell us if he believes that the reason Serco track and trace did not have a clear impact on coronavirus infection rates was due to the failings of the system, or was it because the UK's pitiful statutory sick pay is not sufficient to support those in self-isolation to stay safe and save lives?
Madam Deputy Speaker, well, I think that people across Scotland listening to that will recognise that political point scoring is the opposite of what's needed right now. And what instead the UK government is delivering for people across Scotland is the benefits of this United Kingdom working together. Instead of making arguments for constitutional meddling and separation, we are delivering for people. We are delivering vaccines into arms. We are delivering a testing system that works for people across the whole of the United Kingdom. And crucially, we are also delivering that enormous economic support package to businesses and individuals alike. All of this is only possible because of our great United Kingdom, and I'm glad that the people of Scotland increasingly recognise that.
Video link to Robert Halfon.
Thank you, Madam Deputy Speaker. I welcome my right honourable friend's statement and pay tribute to him for the vaccine programme, along with everyone else in the National Health Service. Can I ask my right honourable friend, given the £200 million already spent on the move of Public Health England to Harlow, first announced by the government in 2015, and the additional £120 million given this year to facilitate the move, can my right honourable friend set out the progress and timings of Public Health England or its successor body, the move to Harlow and the next steps to the completion of the Harlow campus as part of our country's programme to modernise our public health science?
Before I call the Secretary of State, I do want to reiterate again that there is a dress code for when people are participating via video link. We do expect them to be dressed in the same way as they would be if they were in the chamber, i.e. with a jacket. Secretary of State.
Madam Deputy Speaker, if I may say so, I think my right honourable friend would wear that tie if he was in the chamber as well. He makes a very important point about the future of investment in public health. He's a great champion for Harlow. He and I have spoken about the Harlow project many times. As he knows, we're reforming the way that we deliver public health to make sure that the delivery of health security especially against contagious diseases, gets its own special focus, as well as, of course, the vital work of health improvement to improve public health amongst non-contagious diseases like tackling obesity. And the Harlow project has been something that's been worked on for some time, and I look forward to working with him on the next steps in that programme.
We now go to Munira Wilson.
Thank you very much, Madam Deputy Speaker. The Secretary of State rightly paid tribute to the service and sacrifice of NHS staff over the past year. Several honourable members from his own benches joined me in speaking to nurses and RCN representatives from across South West London last week. The message to us was clear. They're traumatised and exhausted after treating thousands of severely ill COVID patients, and they are insulted by the proposed 1% pay rise. So will he follow the example of the Welsh Government and offer NHS workers a £500 tax-free bonus as well as a real terms pay increase?
8.
Well, thank you very much, Madam Deputy Speaker. As the Honourable Lady knows, we are in a difficult economic situation due to the pandemic, and around 700,000 people have lost their jobs. As a result, we've implemented a public sector pay freeze across the public sector for all but the lowest paid workers and NHS staff. As she knows, the independent pay review body is looking at this point. But I bow to no one in my admiration, like her, for the work of staff across the NHS who have worked incredibly hard and have done a huge amount in order to help people through this pandemic. And she's absolutely right that we must support them, especially in getting R&R after this latest peak, because we also have work ahead of us to make sure that we can deal with the consequences of COVID, including the backlogs that I announced the financial support to crack through today.
We now go to Stephen Hammond.
Thank you, Madam Deputy Speaker. And can I thank my right honourable friend for his statement. The rollout of the vaccines has been truly impressive and undoubtedly led to some heightened expectations. From experience, I recognise that the supply letter from NHS England to the system was not actually unusual. So does my right honourable friend agree that there is a possibility that an equally appropriate phrase for the current supply fluctuation might be expected level rather than constrained? And can I ask him to allay the fears of the people of Wimbledon and the UK and confirm that he expects supply levels to be in line with expectations over the next few months and that no target dates for vaccinations will be missed?
I can absolutely give that assurance, and he's quite right, and he brings his experience as a incredibly impressive health minister to bear. It is absolutely standard to tell the system what our future expectations are, but they are expectations, and we're always clear that supply is lumpy. We've set out clear commitments to the public, and those commitments, which come either from myself or from the Prime Minister, are the ones that we will meet. And of course, we manage this enormous programme in order to deliver them as best we can.
Jim Shannon.
Speaker, can I also thank the Secretary of State for his continued updates on these issues in the Chamber. As a type 2 diabetic who lost 4 stone weight when I was diagnosed with diabetes some 13 years ago. I've come to understand the importance of a healthy weight. My specific concern for the reported vaccine supply is that the overweight who are ostensibly more vulnerable to coronavirus must have access to the vaccine. So can the Minister confirm that shipments to Northern Ireland will continue as scheduled, and further, if clinical priority will continue to be given to those with a high BMI despite the alleged shortage? Thank you.
Yes. People listening to the news over the last 24 hours might be surprised to hear this, but there are no changes to the prioritisation. There are no changes to planned appointments, and the people will be called forward as previously proposed in the order previously proposed, including with the addition of opening up invitations to those who are 50 and above. And the vaccines will be delivered by the NHS across the whole of the United Kingdom, including in Northern Ireland, where I work extremely closely with my counterpart.
Thank you, Young.
Thank you, Madam Deputy Speaker. The vaccine rollout has been a tremendous success, and just 100 days after the first jab, we've vaccinated 25 million people. In front of the Science and Tech Select Committee yesterday, Dominic Cummings made reference to the vaccine rollout and criticised civil servants in the Department of Health. Could the Secretary of State outline the decision-making process that led to the vaccine task force and the most successful vaccine rollout in the world?
Absolutely. You see, the thing about the vaccine rollout and the vaccine delivery and the purchase of vaccines and the scientific research into vaccines is that the whole thing has been a massive team effort. And I thank some people in my opening statement who have been involved, and they have worked incredibly hard together as one big team. That's the attitude that we take, and that's one of the reasons why this programme has been successful. And in particular, I want to emphasise my gratitude to officials in the Department for Health and Social Care who've worked incredibly hard and very, very effectively at making this happen.
We now go to Mick Whitley, but I should just say we've got 22 people to get through and something like 26 minutes to do that. So we need to be brisk. Mick Whitley.
Thank you, Madam Deputy Speaker. Care home workers have made enormous sacrifices over the last year to keep their residents safe and continue to work on the front lines of the pandemic. Can the Secretary of State inform the House what he's doing to increase uptake of the COVID vaccine in care home staff, and whether high-risk care home staff who have come forward for vaccination in April will be able to get their first dose? Thank you.
Yes, absolutely. He's quite right. I totally agree with him. Anybody who works in an elderly care home should come forward now for a vaccine if they haven't had it. And we're working incredibly hard to try to make those vaccines as accessible as possible.
We now get Chris Grayling.
Madam Deputy Speaker, thanks to the work of the Secretary of State and his team, I represent a constituency where most over 50s have had their first jab, where there are now very few COVID patients in local hospitals, and where the rate of infections is very low and still falling. But I also represent a constituency where hospitality businesses are going bust right now because they can't hang on any longer. Given the fact that the Secretary of State says that outdoor settings are very low risk, why do COVID-secure hospitality businesses with table service in outdoor settings still have to wait another month to reopen when the data shows pretty clearly that it would be fine for them to reopen now?
Thank you very much, Madam Deputy Speaker. We've set out the roadmap based on clinical advice, and I'm delighted to say that because of the success of the vaccination programme so far, we're able to proceed down that roadmap.
Video link to Kim Johnson.
Thank you, Madam Deputy Speaker. And I'd like to start by giving my unreserved support to the NHS for the massively successful rollout of the vaccine programme. But can the Secretary of State assure the House today that given the unpredictability of supply, that all of those due their second dose will receive it within the specified 12-week time period? Thank you, Madam Deputy Speaker.
Yes.
We now go to, by video link, to Sir John Redwood.
Many congratulations to the Secretary of State and his team on the vaccine rollout. It does indeed show the success of collaboration between government, business and universities, and a beneficial side effect of more high-quality jobs, more self-reliance and productive capacity in the UK, which I hope we will follow in other areas. Can you give us a brief update on progress with finding new treatments for COVID-19 and applying existing drugs?
Entirely, 100%, wholeheartedly agree with my right honourable friend. And the model that we established in the Vaccines Task Force of this holy trinity of business, academia and civil service colleagues working together as one team is something that was learned from reforms from his time in government and is something that has worked incredibly well, and I think will do as well in the future. We also apply that approach to therapeutics, and one of the reasons, alongside the NHS, that we are the only country in the world who's participated in the discovery of all the current therapeutics is because of this approach, and obviously we're driving it further, and I'd be very happy to discuss it with my right honourable friend.
We now go to Dan Jarvis.
Thank you very much, Madam Deputy Speaker. One of the gravest threats posed by COVID is its potential to create a cancer epidemic. I recently coordinated a cross-party letter to the Secretary of State in support of an urgently needed £50 million refurbishment plan for Sheffield's Western Park Cancer Centre. Can I urge the Secretary of State to give serious consideration to the proposal, which would ensure patients across South Yorkshire and Bassetlaw receive the best possible treatment?
Secretary of State.
Yes, thank you very much, Madam Deputy Speaker. And I have seen the letter and I'm looking into what we can do. The need to tackle cancer is both more urgent because of the crisis, but also has more hope. And the hope is that the same underlying technology behind some of the vaccines, the so-called mRNA technology, also has the potential to improve radically cancer-fighting technology. And so we propose and plan to support very significantly work in this in order to find further breakthroughs in cancer treatment. And I'd be very happy to talk to him and indeed you about the proposal for South Yorkshire.
We now have video link to Duncan Baker.
Thank you, Madam Deputy Speaker. Given the sterling success of the vaccination rollout in North Norfolk, where on recent numbers we had vaccinated the second highest number of people by constituency population in the whole country, can my right honourable friend assure my constituents that despite the recent supply news, the vast majority of them will see no interruption to them being given their first and second doses in the rollout programme?
Yes.
Yeah. Video link to Barry Shearman.
Madam Deputy Speaker, the Secretary of State knows that I sometimes criticise him, but I sometimes pat him on the back. And I want to pat him on the back in terms of much of what he's done. And yesterday's evidence from a select committee just shows he didn't always get the support he needed from Number 10 and from Dominic Cummings in particular. But can I tell him that what I want to see is a level playing field, whether it's Harlow or Richmond or Huddersfield. There is some resistance to getting the vaccine in some of our urban centres. And can I assure him that I will work with him and we all will work cross-bench to make sure that people know it's so vital to get the vaccine wherever they live. And I hope we can have a good PR effort working together to do that.
Thank you. Secretary of State.
Madam Deputy Speaker, I'm a pretty collegiate kind of guy, and I generally see the best in people, and I see the best in the honourable gentleman. One of the things that I've really enjoyed about this vaccine rollout is that it has been a totally cross-party effort, and people have really lent in to getting the message out. I look forward to working with my honourable friend on certainly today in what he suggests.
A video link to Dr. Luke Evans.
Thank you, Madam Deputy Speaker. And the Health Secretary will know from coming to the Health Select Committee how we're concerned about dealing with the backlog. So it's great for him to be taking such a proactive stance to deal with that backlog. He set out in his speech just how big that backlog is going to be for the elective surgeries. So can he ask, because the question coming from Bosworth would be, how long does he think it will take as an estimate to clear all the backlog that's built up on the elective surgeries?
I'm working with the NHS to answer that question right now. It's a characteristically acute question from my honourable friend, we aren't able yet to answer it simply because the pace at which we can return activity to full normal levels is not yet clear, because the main barrier to that recovery is a combination of infection prevention and control and the need for staff to get some R&R. We'll know more in the coming weeks and months.
Video link to Tim Farron.
Thank you. There is not a mention in the Secretary of State's statement of cancer, nor a single penny in the budget to boost cancer services, despite Macmillan Cancer's figures that show a need to increase all cancer services by 10% for a full solid 15 months starting now to clear the cancer backlog. Macmillan also say that there are 37,000 people with cancer who are not yet even in the system. Given this crisis and the scale of it, will he agree to an urgent, ambitious and funded plan to catch up with cancer so that tens of thousands of people do not unnecessarily lose their lives?
Chief State.
The need to catch up on the backlog is across all elective operations, and of course that includes cancer. The good news is that the NHS worked incredibly hard, especially in this second peak, to make sure that cancer services remained working and effective as much as is possible. And some cancer services, in fact, delivered more than their normal pre-pandemic levels of care. So absolutely he's right that we've got to make sure that any backlog is reduced. That is a critical part of what I've been talking about today.
Video link to Pauline Latham.
Thank you, Madam Deputy Speaker. The vaccine rollout has been incredibly successful. We have just come against a bit of a hiccup now with the AstraZeneca vaccine. Now, Europe don't seem to be too keen on using this. Could we not use their vaccine? And could my right honourable friend assure me that the Pfizer vaccine will be available not just for second jabs, but for first jabs during the month of April, please?
Well, my honourable friend has put her finger on a certain irony in two different positions that our European friends are taking at the same time. I think the best thing to say is that I hope that following the MHRA's statement later today and on consideration by the EMA, then we can get this vaccine going everywhere because the data are really very clear that it saves lives. That's what the European Medicines Agency themselves have said throughout the last couple of weeks, and I think it's important to follow the science in this one.
Video link to Charlotte Nichols.
Thank you, Madam Deputy Speaker. I'd like to thank all of those in Warrington involved in the vaccine rollout, including our NHS and community vaccine centres, GPs and primary care networks, pharmacists and volunteers. While I patiently await my own jab as a 29-year-old, I've been so heartened by the progress made so far in getting our community vaccinated. Can the Secretary of State please therefore reassure the House that if high-risk people in the top categories come forward for their first dose of the vaccine, that they won't be prevented from receiving this as a result of anticipated delays to delivery?
That is absolutely our goal, and she's 29, I'm 42. The fact is that you have to that you have to vaccinate an awful lot of people of our age to save the same amount of lives as vaccinating just one octogenarian. So we're going to take this time to loop back and to find as many people in the most vulnerable cohorts as possible. That is the way to save as many lives as possible and to reduce pressure on hospitals as much as is possible. So I hope that she'll bear with, in the same way I'm having to bear with, until we are able then to open up vaccinations for the firstly for those in their 40s, then 30s, then finally the youngsters.
Philip Hollowbone.
Kettering-born Professor Sarah Gilbert of Oxford University, who's led the team that developed the Oxford AstraZeneca vaccine, attended Kettering High School for Girls, which is now Southfield School in the 1970s, and it was at that school that she first decided she wanted to work in medical research. As a heroine of the town, Sarah's name is today being added in a mayoral ceremony to Kettering's historic timeline in the marketplace, which commemorates key milestones, achievements and famous local people. Will the Secretary of State join me in congratulating Sarah on this thoroughly well-deserved accolade from her hometown, praising her outstanding work and recognising her as a role model for young people everywhere who want to enter a worthwhile career in science?
Well, I'm sure that the whole House, Madam Deputy Speaker, will agree with every single word of what my honourable friend has just said. They say success has many fathers, and Kettering has discovered another extraordinary daughter in this vaccine rollout. Sarah Gilbert worked on the Ebola vaccine before this one, and has played a role in saving many, many, many thousands of lives over her career in medical research. And I have no doubt many, many, many more in the future. And we all salute her work, and we salute her attitude and her teamwork too, because that is one of the characteristics that has made it so possible to be able to deliver these vaccines so fast.
Indeed. We now go to Dr. Lisa Cameron.
Many thanks, Madam Deputy Speaker. As chair of the Disability All-Party Parliamentary Group, we have been hearing absolutely heartbreaking accounts that the pandemic has had a disproportionate effect on disabled people across the United Kingdom. According to a survey conducted by the Family Fund, 93% of families said coronavirus had negatively affected disabled or seriously ill children's mental health. So what crucial steps are government taking to support the mental health and well-being of children and adults with disabilities?
She's quite right to raise this, Madam Deputy Speaker. It's an incredibly important subject. Of course, those with disabilities have been recognised in where they have clinical priority for a vaccine, as have their carers, according to clinical advice. And part of the £500 million of mental health funding that I mentioned in my statement will, of course, go towards strengthening further children's mental health services, with the goal that mental and physical health are treated with parity, which, of course, they should be.
Therese Villiers.
The United Kingdom's vaccination programme has been amongst the most successful in the world, right from the point at which the government took the decision to fund the scientists that made it all possible. With these constraints on supply, is he still confident that we can follow our roadmap to release, which is so important to so many families and so many businesses across the country?
Yes, we did fund the science from the start, and we worked collegiately to make that happen. And I can confirm that there is no impact on the roadmap timetable from the news on supply, because we remain on track in terms of the targets that we've set out.
Video link, Mary Kelly Foy.
Thank you, Madam Deputy Speaker. If there are indeed issues with the vaccine supply, it doesn't make sense that countless manufacturers across the world are unable to produce COVID-19 vaccines, treatments, diagnostics and other health technologies because of intellectual property restrictions and pharmaceutical monopolies that prevent open technology sharing. Will the government now commit to supporting a waiver of COVID-19 related patents at the World Trade Organization, or is artificially limiting vaccine supply official government policy?
Madam Deputy Speaker, I'm very happy to provide the Honourable Lady with a briefing because she should be very, very proud of her country, because AstraZeneca are providing the Oxford vaccine free of charge, not charging for any intellectual property rights, right around the world. That isn't true, as she implies, of all of the vaccine companies, but she should be really, really proud of ours.
Video link to Simon Fell.
Thank you, Madam Deputy Speaker. I was listening to the excellent COVID Confidential podcast on the BBC and was surprised and delighted to find out that the various vaccines, when they're in production, were named after submarines that were built in my constituency. So can I firstly thank my right honourable friend on his choice of names, but secondly, not to labour this analogy, a good defence rests on having a good range of options. Kate Bingham recently said that not having monoclonal antibodies as part of our defence is the gap in our armour. Could my right honourable friend possibly give an update on where his department is on this?
Yes, this is an incredibly important subject, and we're working very hard on it with clinical leads and external experts. I said earlier, Madam Deputy Speaker, that success has many fathers, and I'm sure that people of Barrow are very proud of their role in making sure that we could keep what needed to be kept confidential. We've now had to change all those names because everybody knows about it.
Video link, Tulip Sadiq.
Thank you. GP surgeries have been critical to the rollout of the vaccine, and I pay tribute to all those involved. However, many of my constituents are concerned that the Centene Corporation, a massive American health insurance firm, has just taken over dozens of GP surgeries in London, including Bromsbury and Swiss Cottage GP hubs in Hampstead and Kilburn and others in Camden. Does the Secretary of State share their concerns that this appears to have taken place with no meaningful public scrutiny, and about the increasing involvement of US healthcare corporations in our health system?
No.
Video link to Andrew Selou.
Given the link between COVID deaths and obesity, does the Secretary of State share my concern that children from the poorest constituencies are being the most heavily targeted by social media junk food adverts, and that over half of the top UK child influencers on Instagram have promoted junk food in the last year? So will he meet some of the young people from Bite Back 2030 who are concerned about this?
What do you say?
I'd be very happy to ensure that the children from Bite Back 2030 meet with the Minister for Public Health, who leads on these matters. It's an incredibly important point that my honourable friend rightly raises.
Liz Twist.
Thank you, Madam Deputy Speaker. Almost as soon as the Secretary of State sat down yesterday after his statement, I was contacted by a constituent who is shielding and is very concerned that now, having been told that shielding will end on the 31st of March, but hasn't had his second jab. Will the Secretary of State be issuing guidelines on what those people should do, as my constituent is asking?
Yes, absolutely, and we'll be writing to all those who are shielding to set out the details so that they get a personal copy of those guidelines. What I would say is that the rates of COVID now are much lower than when we've had shielding paused in the past. And so it's not just the vaccination programme, which of course has benefited many, many people who are shielding. And we know that the first dose brings huge safety and benefit already. But it's also because the rates of COVID are so much lower.
Video link to Aaron Bell.
Thank you, Madam Deputy Speaker. On behalf of their citizens who need to be vaccinated, who need to see their economies reopen, I have to say I am personally in despair at the short-sighted decisions that have been taken by many European countries and what seems to be their absurd misapplication of the precautionary principle. I'm sure my right honourable friend would wish to be diplomatic, so will he join me in praising what we are doing, both the MHRA and the JCVI, for their sensible and proportionate decision-making, which has always prioritised public health here in the UK, both in respect of the approvals given for vaccines and the dosing regimens they've subsequently recommended?
Yes, my honourable friend puts it characteristically well. It is very important to take all considerations into account when making decisions like these. Of course, the precautionary principle is an important one, but over precaution, when there are such huge benefits to vaccination, is itself a mistake. What you have to do is take the overall public health into account.
Video link, Rebecca Long-Bailey.
Thank you, Madam Deputy Speaker. The Salford system has delivered the COVID vaccine in an unprecedented way. Everyone from cohorts 1 to 9 have been invited at least once, some 3 or 4 times. And I understand that even with the vaccine shortage and guaranteed second doses factored in, we will run out of people in cohorts 1 to 9 to give our current vaccine supply to. So will the Secretary authorise today that Salford may proceed to cohorts 10, 11 and 12 and begin prioritising the vulnerable members of these age groups so that we can maximise the doses we have?
No. What everybody needs to do in Salford, as around the country, is make sure that every last effort is made to reach every last person in groups 1 to 9, because these are the most vulnerable. Only in exceptional circumstances should people under the age of 50 who are not in groups 1 to 9 be invited to vaccination. The message is incredibly clear. Please, the whole team, including in Salford, I'll speak to you very directly. Please put all of your efforts in the forthcoming weeks into delivering vaccines for groups 1 to 9.
The final question is to Jason McCartney.
Thank you, Madam Deputy Speaker. As I'm over 50, I'm getting my Oxford AstraZeneca jab later today at my local Honley Village vaccination centre, where they've now delivered over 10,000 vaccinations. Will the Health Secretary please join me in thanking our wonderful local NHS, the pharmacy involved and all the volunteers there, and just confirm once again we're still on track to vaccinate all over 50s and deliver the second doses as planned?
Yes, absolutely, and it's wonderful to see the joy on his face in anticipation of his jab. May I say, Madam Deputy Speaker, I hope that he gets the opportunity to change, maybe into a short sleeve shirt, because we have seen some colleagues inadvertently have to undo an awful lot of buttons in order to be vaccinated. And whilst I can imagine that some of their more enthusiastic constituents may have enjoyed the sight, I think it's best if we gents wear a short sleeve shirt so that we don't have to bare our hairy chests.
I thank the Secretary of State for his statement and will suspend the House for approximately 3 minutes to make the necessary arrangements for the next business. Order, order. We now come to the Select Committee statement. William Ragg will speak for up to 10 minutes, during which no interventions may be made or taken. At the conclusion of his statement, I will call members to put questions on the subject of the statement.